5 techniques to delay ejaculation and last longer in bed. Ladies and gentlemen, these complaints of some form of dysfunction, dissatisfaction in relation to lovemaking, having fun, is really aching. And in reproductive health, it is our desire to target our audience and improve on their knowledge on how to live healthily, on how to improve on certain conditions. This is one of them today. Remember, with ejaculation, there are several problems. There are 3 main problems that are associated with ejaculation. That is the release of semen, during sexual intercourse. These 3 main problems are, premature ejaculation, delayed ejaculation, and what we call retrograde ejaculation. This video today targets only premature ejaculation. How can you manage it? A lot of people complain that while making it up with their partners, they do not last long. They go only for a few minutes, 1 minute, 2 minutes. Reason for which you hear some fun kind of words in our communities these days, describing some people as 1 minute man, 2 minute man. Some people feel so depressed, so worried, so disturbed about it. Now, our video targets you, how you can improve on it. Don't forget, if you have a persistent sign or symptom of a problem, you have to go see your doctor. Visit the hospital and go through a consultation process. There are several causes of this, which is not the aim of our video. Our aim of video here is to bring you the different techniques that you can prolong. You can last. If you were lasting only 1 minute or 2 minutes, you can actually last for 5 minutes, 8 minutes. Yes, if you apply these techniques. I said for people who are healthy, yet for one reason or the other, they suffer from this weakness or from this premature release. Again, you might not even know whether you are sick. I have drawn your attention to the fact that when you are having such quick ejaculation, it is an indication that there is a problem that experts in the field of health, your medic, will understand. So you can go to the hospital and consult. So they can diagnose or they can discover a problem and treat it. Just by treating the problem, the issue of premature ejaculation is resolved. And then you start lasting long. Check your feeding. The quality of what you eat may automatically, change your 1 minute nature, your 2 minute nature. There are certain foods. Remember, there are videos we have done that will improve on blood supply, on the health of the genitals, and of course, will improve on your situation. But now, what are the techniques you can take to prolong and last longer in bed? 1, the squeeze method of Masters and Johnson, meaning that there's a method that has to do with squeezing. And they'll describe that in the course of friction, of intercourse, when you feel that you are approaching ejaculation, it is a feeling that you are approaching orgasm, then quickly pull out the penis. Usually we advise the partner to do it, to learn how to do it, the woman. But if the woman cannot understand it, and the man cannot even take time to explain to the partner to understand, then the man can intentionally do it. When you start feeling or approaching ejaculation, a lot of women are so sensitive to this. Some even warn the man that, hey, never make that thing. I'm not satisfied. I've not even tested. In fact, I've not even started because they like notice the man is somehow contracting, like twitching. They know that it's already coming. A lady who understands this quickly pulls out the penis and hold it on the shaft near the tip, near the glands, and squeeze. But you don't squeeze and hold, else you'll kill it, you'll destroy it. You just squeeze once, leave it. Once, like you just squeeze and count 1, 2, 3, leave it. Count again. 1, 2, 3, leave it. 1, 2, 3, leave it. Just 3 times. The ejaculation feeling goes off, but the erection increases. So that the man will start again. And it will prolong. When you start having that feeling, pull it up, whap, 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 3 times, leave it. It will start all over. That is a squeeze technique. There is knowledge. Try it. And then you can give some testimony on our comment section. Number 2, periodic suspense. Just before ejaculation. This is another thing, but you're not squeezing. You are in the process making fun. At the time you start having some feeling of ejaculation, you quickly pull out, completely pull out, and relax. Don't even touch that penis. There might be some tension inside, a bit and cool down. Just for between 10 to 20 seconds, 30 seconds, 1 minute at most, you penetrate again. The energy is starting afresh. And in your usual 2 minutes, you start making like you're feeling something, suspend it, bring out, lie down. 30 seconds, 1 minute, the feeling is off, the erection remains. Continue. So you see, it's also a technique. Number 3, masturbating an hour before sex. Yes, this will reduce sensation during sex. And those that already had some ejaculation, it will take time again before the next ejaculation. So there are some people who know that they are 1 minute, they are 2 minutes. While preparing for this session with their partner, you see some intentionally masturbate 1 hour before the fun. So that during that time they will not call them 2 minutes, because during the time now you prolong. Ejaculate will not come too fast. Number 4, use condoms. Yes. If you did not know, hear it. When you have erection and you wear a condom, it reduces the feeling, the sensation, and the exercise goes longer. It goes long like that because the feeling, the sensation is really reduced. Number 5, use of medications. There are certain medications, for example, antidepressants. Yes, that will reduce sensation, reduce feeling, and then could prolong the exercise, and people enjoy it. There are equally certain anesthetic agents or medications that can cause numbness. Okay, there are different types. There are some that are sprays, there are creams, and so on. But they contain this anesthetic or numbing agent that they can apply on the penis, 10 to 20 minutes before sex. It is going to automatically delay, and then you prolong a bit. Number 6, positions with less arousal. There are certain positions that when you take the exercise of love making, when you take the exercise on love making, you cannot quickly ejaculate because the arousal reduces. So you can try different positions, and the position that you take, and notice that no matter how you take, you cannot even reach ejaculation. You may need to change that position to the one that is the arousal increases. Then take the position that the arousal is reduced. You will prolong. Number 7, take a break and think of another thing other than sex. Simple. It's a technique. that you are in the exercise, and before you know it, there's a feeling coming as if you want to reach orgasm and then ejaculate. Then they tell you, quickly pull out and change the topic. There was a day that one of my uncles brought this topic, well-learned uncle of mine. And someday we brought this topic and discussing, and he gave an example that yes, it has happened to him, but sometimes, since he understands these things, when he start feeling like that, he quickly pull up and then change the topic and asking the madam, for example, how much did you say you have to pay the school fees? You have to pay to collect that dress again. Oh, you say you wanted to make that hair. Sometimes you see the woman just make time this for ask that kind of question. Is this when to ask that kind of question? But the man knows that transient, that short moment of relaxed and distracting mind, take off the feeling of ejaculation. Erection will remain. And then he say, okay, sorry, and continue again. Then it prolongs a bit. Use your head. Number 7, okay, that was 7. We say take a break in the course of making fun or having fun. Then think of something else. Then you quickly distract the mind. Number 8, there are pelvic floor exercises, Kegel exercises, and something like acupuncture that also helps. Yes, there are also techniques to prolong, in bed. Thank you. My name is Dr. David Ayem. I am in Bamenda, Cameroon. I am your midwife, your reproductive health expert. Please write your comments. If you have not subscribed to this channel, please do. Subscribe, like, and share. Then you can always write your comments. You can also write to me. You can consult with me one-on-one, through WhatsApp. I will always give you this contact, 694-35-3141. If you are not in Cameroon, always start with +237. Write only messages or voicemail, yes, like we have been doing. Then we can always find time to attend to you. Thank you. God bless you.